The Food and Drug Administration's top inspector is set to step aside later this month. Michael Rogers says it's time to retire after 34 years at the agency. Two FDA officials tell CBS News he recently struggled as his agency faced sweeping funding cuts. 20 Democratic state attorneys general are suing the Trump administration over its federal health cuts and restructuring of the Health and Human Services Department. The department is led by Secretary Robert F. Kennedy Jr. New York Attorney General Letitia James, who's leading the coalition, says, quote, "This administration is not streamlining the federal government. They are sabotaging it." For more on this, I want to bring in Julie Rovner. She is the chief Washington correspondent for KFF Health News and the host of the health policy news podcast, What the Health. Julie, always good to see you. Lay out for us this restructuring and what these attorneys general are arguing.
Well, what they're saying is that sort of a combination of, they've cut almost a quarter of the workforce at the Department of Health and Human Services, and they've canceled billions of dollars in grants and contracts and things that are not supposed to be stopped except for cause. And there was no cause. Some of them, they said it was, because they were funding DEI projects, which in some cases was true, in some cases it wasn't. And these attorneys generals are saying that it's hurting their states. It's hurting the services. We're seeing clinics start to close and programs start to close down. And don't confuse this with the president's budget that came up last week, which was a request to Congress to cut these programs. They've unilaterally cut all of these programs, which every court that's looked at it has basically said is illegal.
And KFF recently reported on how these cuts are impacting HIV/AIDS prevention and testing in particular. In his first term, we remember President Trump pledged to end HIV in America. What are we seeing this time around?
Yeah, this time we're seeing the exact opposite, that they have basically taken back money. This was money that was originally appropriated to deal with the COVID pandemic, but is now going to basically fund public health all around the country in many very red states with a lot of people who voted for President Trump. And they're basically just taking that money back and leaving people high and dry. At this point in the South, there are fewer people who are being appropriately treated for HIV than there are in parts of Africa.
We have been following the Trump administration asking a judge to dismiss a lawsuit against an abortion pill. Can you remind us of this case, and do we know the administration's stance on mifepristone access?
Yeah, and this, of course, has been a big question. This was a case where a number of doctors had sued to try to get the FDA to roll back its approval of the abortion pill. The Supreme Court last year said that those doctors did not have standing to sue, so instead 3 states stepped in. But none of them is Texas, which is where the lawsuit is. And so the administration kind of managed to play it both ways, saying that, well, we think that this particular case should be dismissed because these states don't have standing in Texas, which they clearly don't. But it doesn't necessarily say that the administration isn't going to do something on its own to the abortion pill to change its approval, and that if this case gets dropped, it might make it easier for courts to then turn down blue states that would sue if indeed the Trump FDA does try to roll back the approval of this abortion pill.
And Julie, from hosting your podcast, what are you finding is maybe the number one or number two questions that you're getting from the public on what they want to know regarding cuts to this department?
I think people really want to know sort of what's going to happen next, and whether all of these cuts are going to start impacting how people actually get medical care. And, we haven't seen a lot of it yet, but that's because it's still pretty early, and we're waiting for sort of the other shoe to drop.
Julie Rovner, thank you for your time.